Hi, today is Friday the 9th of November 2012. This is a bit late, sorry, but on Wednesday I was 16 weeks pregnant, or 17, depending on whether you want to go on my last menstrual date or the scan I had. I went to the midwife last week, which was really good, because I got to listen to the heartbeat for the first time, which was brilliant. It was really, really good. She found it straight away, which I was really surprised. I thought she was going to have to feel it for ages, but she found it instantly. And it was 152 beats per minute, which I think is quite good. So yeah, there really isn't much to report actually. I don't think I've felt the baby move yet. The midwife has asked me if I have. I really don't know. It's really hard to say if I have or not, but nothing definite anyway. So I'm getting a little bit worried about that. I know I have read that it says first time mums sometimes don't feel the baby move until between 16 and 20 weeks, so it's still fairly early really. So we just have to wait and see. My 20-week scan is it's less than 3 weeks away now, so that is so exciting. I cannot wait to see how much the baby has grown, because I think I have definitely grown, my stomach has. I'm still producing the colostrum from my nipples, so yeah, it's really exciting. At university we've actually had a few lectures about maternal care and babies, so that's been interesting and a bit frightening, because they've been talking about tearing and episiotomies and oh gosh, just stuff you really just don't want to know about yet. But the midwife that I had today, she is a research midwife, and she does a lot of randomised controlled trials to test out techniques and things for pregnant women. And she was saying that she is a real advocate of water births, and that she always tries to promote water births to pregnant women, just that she thinks it's a really natural way of doing it. She did this controlled trial with women that was to see what the effect of the water birth would be. And she said the women that have water births are much less likely to have pethidine. They don't really have epidurals, because you can't when you're in the water. So she sees it as a really a good way to birth. And another really interesting thing she said was that if you are a low risk mother, and that's also the baby, if the baby is low risk, then even if it's your first child, then you should really try. She recommends having the baby at home, which is contrary to other information I've heard, which has said that first time mothers shouldn't have a baby at home. But I asked her about it, and she said yes, if you are low risk, and that's really important, if you and your baby are low risk, then there's absolutely no reason why you shouldn't. And in fact, she recommends that you have your baby at home, because once you get into hospital you are stressed. The more stressed you are, that adrenaline and stress actually works against the oxytocin, which is the chemical that's in your womb that helps your cervix to dilate. So and also there's more interventions are likely to take place. So for instance, if there's complications, sometimes not even massive complications, but they will be more ready to say, let's have a cesarean section, let's have these drugs, let's give you this strip that's going to make you progress quicker. And at home there isn't so much of that. You are just let to do things naturally, and obviously if there is a trouble, then you do go to the hospital. That's fine. Another thing she was saying that I didn't realise was that you can choose where you want to go. If you decide that there's a really good, because she says don't go to hospital, you should go to a midwife-led centre, which I hadn't even heard anything about. So there's one fairly near me, I think, but it's not the most local hospital. If I decided that was where I wanted to go, I can then say to my midwife, this is where I want to go. I want to go to this birthing centre. I don't want to go to my local hospital, which is really good. They've really, more than nursing, actually, midwives do give women a lot of choice about their own care, which is really important. And the other thing the midwife that was taking the lecture today was saying was about the injection, and I can't remember what it's called now, but that they give you to God, what's it called? It's really on me. I can't remember. That they give you in your leg when you're in the third stage of labour, which is delivering the placenta, and this helps to deliver the placenta. But that only makes it about 30 seconds quicker. So any women out there that are getting near to having birth, or don't let them give you that injection to get to give birth to the afterbirth. Give it some time. If it's dragging on and it just isn't happening, then fine. But if these medical people are just injecting you, not even asking you first, and say, no, hang on a minute, I want to let it do naturally, there can be more complications if they give you these injections. It can cause more bleeding. It can just make things a lot worse. So, one thing I'm really getting interested in is just having as little medical intervention as possible. And I really wasn't like that at the start. I was like, no, go for it. I want everything. Give me everything. I want to go to the hospital. But I'm not sure that's the best thing anymore. Women's bodies are made to give birth. And yeah, there are problems. And when there are problems, you can have medical help. But most people really don't need that. And it's put upon them without their wanting it, without being asked if that's what they want. So it's interesting. I'm going to do some more research on that actually, about birthing at home, and it's quite a scary thought. I can't imagine giving birth at home, but I've always from the start, even before I was pregnant, wanted to have a water birth. So that is something that I really do want to go ahead with, whether that's at home or if it's in a midwife-led birthing centre. One other thing I was going to say, the trace that they put on you across your stomach, which is like a belt, like kind of two belts, that monitors your heartbeat and the baby's heartbeat. I don't know if you realise that's actually never been trialled. One person had a good idea of using it, and they've just kept using it. No one's actually trialled this equipment to see if it's actually that useful. Why, midwives don't use the little ear horn things they used to use to listen to your stomach. All these things have gone out of the window, and really there's no real evidence to say that this this technology is any better, or sometimes it can be worse. Because what midwives are doing, and nurses as well do this, they're listening to the beeps of the machines, and thinking, oh, what's something wrong, what's going on, when actually they haven't even looked at their patient to see how the patient's getting on. It might just be that a lead has come loose and there's nothing wrong with the woman at all. So anyway, it's all very interesting. I will keep you posted on what I find out. But for now, that's all. I will keep you posted. My next update will be, it will actually be 18 weeks. I'm going to start using the scan date, that they found, that they decided it was, rather than the last period date, because this is now what my midwife is using. So I'm going to say this is 17 weeks and next week's going to be 18. So, but really, as far as the pregnancy is concerned, there's nothing to really say. I feel really good actually. A lot of people are saying I look good, that my skin looks good, so I'm just gonna pray that I carry on feeling really good, and because I start my new placement next week, so I've got to keep my energy levels up, and then when that placement finishes, which is on January the 25th, I'm going to be 29 weeks pregnant, which is a crazy thought, because I just can't even imagine that. I keep thinking all the time, oh, there's something wrong with the baby, or something's going to go wrong, but I'm just trying to keep a positive head anyway. But I will speak to you soon. Thanks for watching. Bye.